Basic care and safety. 1. Hand hygiene is the #1 way to prevent infection. Wash your hands for 20 seconds with soap and water if visibly soiled, or use an alcohol-based hand rub if not. 2. Standard precautions are used for all patients and all body fluids except sweat. This includes wearing gloves and performing hand hygiene before and after contact. 3. Transmission-based precautions add to standard precautions. Contact precautions require gown and gloves, for example with MRSA or C. diff. And remember, C. diff requires soap and water. Droplet precautions require a mask within 3 feet, such as with influenza or pertussis. Airborne precautions require an N95 mask, such as with tuberculosis, measles, or chickenpox. 4. Fall prevention includes keeping the call light in reach, non-slip socks, the bed in the lowest position, and rounding hourly. 5. Restraints are always the last resort. They require a provider prescription, circulation must be checked every 2 hours, and they should be removed frequently for range of motion. 6. For patients with confusion or dementia, provide frequent orientation, use a sitter if needed, and consider alarm systems. 7. Oxygen safety means no smoking or open flames and avoid petroleum jelly near the face or tubing. 8. Fire safety follows RACE, rescue, alarm, contain, extinguish, and PASS, pull, aim, squeeze, sweep. 9. 3 or more side rails are considered a restraint unless medically necessary. 10. For safe transfers, use a gait belt, use a lift device if the patient is non-weight bearing, and always lock wheels. Vital signs and monitoring. 11. Normal adult vital signs include a temperature of 36.5 to 37.5 degrees Celsius, a heart rate of 60 to 100, a respiratory rate of 12 to 20, and a blood pressure less than 120/80. 12. Pulse oximetry should be greater than 95%. Always check probe placement and be aware that nail polish can interfere. 13. Orthostatic blood pressure is defined as a drop of 20 systolic or 10 diastolic, which increases the risk for falls. 14. Pain is assessed using a 0 to 10 scale and must be reassessed after interventions. 15. A Glasgow Coma Scale score less than 8 indicates coma and the need for airway protection. 16. For telemetry monitoring, verify lead placement and prepare the skin to reduce artifact. 17. Rectal temperature is the most accurate route, but avoid it if the patient is neutropenic or thrombocytopenic. 18. Take an apical pulse for 1 full minute when giving cardiac medications, such as digoxin or beta blockers. 19. A pulse deficit is the difference between apical and radial pulses, which indicates arrhythmia. 20. For intake and output, report urine output less than 30 milliliters per hour, as this signals kidney perfusion problems, infection control, and sterility. 21. Surgical asepsis means sterile touches sterile, and if you are unsure, consider it contaminated. 22. Put on personal protective equipment in this order: gown, mask, goggles, then gloves. 23. Remove protective equipment in this order: gloves, goggles, gown, then mask. 24. Foley catheter care requires sterile technique for insertion, daily pericare, and securing the catheter to the thigh. 25. Central line care includes sterile dressing changes and scrubbing the hub for 15 seconds. 26. Collect midstream urine specimens into a sterile cup. 27. Neutropenic precautions include wearing a mask and avoiding fresh flowers, raw fruits, and vegetables. 28. Dispose of sharps in a puncture-resistant container. Never recap needles. 29. In wound care, clean from the cleanest area to the dirtiest area, measure wound size and drainage. 30. Isolation meals should be served on disposable trays and utensils for patients on strict contact precautions. Positioning and mobility. 31. Supine is flat and back-lying, which increases the risk of aspiration. 32. Fowler's is 45 to 60 degrees, best for respiratory distress. 33. High Fowler's is 90 degrees, used to prevent aspiration and for NG tube insertion. 34. Semi-Fowler's is 30 to 45 degrees, promoting lung expansion. 35. Prone position improves oxygenation in acute respiratory distress syndrome. 36. Lateral position reduces aspiration risk and helps prevent pressure ulcers. 37. Trendelenburg increases venous return, used for shock. 38. Reverse Trendelenburg promotes gastric emptying and prevents reflux. 39. Logrolling is used for spinal precautions to keep the spine aligned. 40. Range of motion exercises prevent contractures and promote circulation. fluids, nutrition, and elimination. 41. Daily fluid needs are about 2 to 3 liters per day unless restricted. 42. Clear liquid diet includes broth, tea, and gelatin, and should be advanced as tolerated. 43. Full liquid diet includes dairy products, puddings, and soups. 44. Check NG tube placement with X-ray or with gastric aspirate that has a pH less than 5. 45. For enteral feeding, keep the head of bed at least 30 degrees, check residuals, and flush with 30 milliliters of water. 46. Total parenteral nutrition must be given through a central line. Monitor glucose and infection risk. 47. After Foley removal, assess for voiding within 6 to 8 hours. 48. Prevent constipation with fluids, fiber, and ambulation. 49. Tube feed diarrhea can be improved by slowing the rate or using room temperature formula. 50. Daily weights are the most accurate way to measure fluid balance. Diagnostic and skills. 51. Informed consent must be obtained by the provider. The nurse only witnesses the signature. 52. For pre-procedure teaching, clarify information but do not provide new teaching. 53. For blood draws, verify patient identity with 2 identifiers and label the specimen at the bedside. 54. Transport specimens in a biohazard bag for all body fluids. 55. Post-operative incentive spirometry should be used 10 times per hour while awake. 56. Sequential compression devices prevent blood clots and should be removed for skin checks. 57. Oxygen delivery. Nasal cannula 1 to 6 liters provides 24 to 44%. Simple mask 6 to 10 liters provides 40 to 60%. Non-rebreather mask can provide up to 100%. 58. Perform chest physiotherapy before meals, never after. 59. Suctioning should last no more than 10 to 15 seconds with pre-oxygenation beforehand. 60. Tracheostomy care requires sterile technique, and an extra cannula should be kept at the bedside. Patient education and rights. 61. Patient rights include the right to be informed, to privacy, and to refuse care. 62. Advanced directives include living wills and durable power of attorney. 63. Confidentiality must follow HIPAA. Do not discuss patient information in hallways. 64. The teach-back method is the best way to confirm understanding. 65. Use plain language and avoid jargon to improve health literacy. 66. Only use certified medical interpreters, not family members. 67. Discharge teaching should include medication instructions, follow-up care, and red flag symptoms. 68. Informed refusal must be documented and the provider notified. 69. Registered nurses cannot delegate assessment, teaching, or evaluation. 70. Cultural competence means respecting practices and asking about patient preferences. Documentation and communication. 71. Handoff reports should follow SBAR, situation, background, assessment, and recommendation. 72. Charting should be objective, timely, and without personal opinions. 73. Incident reports do not go in the patient's chart. They go to risk management. 74. Telephone orders must be read back and verified. 75. Late entries should be documented with the current date and time, noting that it is a late entry. 76. Avoid error-prone abbreviations such as U, QD, and MS. 77. Patient identifiers must always include name and date of birth for every procedure. 78. Bedside shift report is preferred for safety and engagement. 79. Critical values must be reported immediately. 80. For ethical dilemmas, involve the ethics committee if unresolved. Emergencies and critical care. 81. CPR compression depth is 2 inches or 5 centimeters at a rate of 100 to 120 per minute. 82. After using an AED, resume CPR immediately. 83. For anaphylaxis, give epinephrine intramuscularly first, then secure airway and oxygen. 84. Hypoglycemia under 70 is treated with 15 grams of carbohydrates, then recheck in 15 minutes. 85. For seizures, place the patient on their side, keep suction available, and do not use restraints. 86. Stroke recognition follows fast. Face, arms, speech, time. Maintain the airway. 87. Shock management includes oxygen, fluids, and placing the patient flat. 88. Always verify code status on admission. Full code or do not resuscitate. 89. Call a rapid response if respiratory rate is less than 8 or greater than 28, heart rate less than 40 or greater than 130, or oxygen saturation under 90%. 90. After a fall, assess the patient before moving and notify the provider. Miscellaneous essentials. 91. Use chain of command to escalate unresolved safety concerns. 92. Critical labs include potassium, glucose, troponin, and INR. 93. Blood transfusions require consent, a 2-nurse check, baseline vital signs, and staying with the patient for the first 15 minutes. 94. If a transfusion reaction occurs, stop the transfusion, keep the IV open with normal saline, and notify the provider. 95. Advanced care planning should be discussed early, not during a crisis. 96. Hospice is for patients with a prognosis of less than 6 months. Palliative care can be for any stage. 97. Delegate to unlicensed personnel hygiene, ambulation, and vital signs for stable patients only. 98. Delegate to licensed practical nurses the care of stable patients, oral medications, and wound care. 99. Priority framework always follows ABCs, Maslow, and safety. 100. Good time management means clustering care and prioritizing the sickest patients first.